I think from my angle, apologize for being somewhat general in my response, but I want to highlight a couple of components that come to mind about based on the discussion we're having this morning and Joanne's side discussions we've had already on your ambition. So for me, I would start at the horizon and then work back in 3 steps. Yeah, so for me, the discussion is what solution do we want in place and how does money get into the system? So for me, that's always the first discussion. It's not so much, because we work early stage, it's not so much about the feasibility or the first stage rollout. It really is, okay, what do we want to get to? Yeah. And if we then understand how we get more money into the system, whether it's from governments, from donors, from investors, from the National Health Insurance Fund, whatever kind of solution we seek to bring more money into the system, then the question is, okay, but before that money comes into the system, what proof points do they need? And then we talk feasibility, then we talk initial rollout, we talk, the phase prior to that, where we normally are active in with my business development mandate. And then if we look at that, we basically say, okay, what do they need to see? And then if you talk about what they need to see, I'm really talking about business models. I'm not talking about technical solutions. The technical solutions need to be proven. And I'm talking now from our perspective. But we want technical readiness level 7 at least. Yeah, if we put solutions in place, because don't complicate a new approach or a new model with also new technical solutions. Yeah, because we talked about over engineering already before, and indeed we have to try to make it as simple as possible because we won't be able to keep it simple anyway. So at least we want to have as low as possible, at least technical challenges on individual solutions. And then the third step, working back, is then the TA to really define the scope of works for the feasibility and make sure that everybody agrees and signs up to what success looks like. And so what's the success at the end of the feasibility that will entice the various parties to commit to the overall structure we have in mind, which would bring us to the horizon in the end. So working back, what's the big picture, and finding out what, with money coming in, what you need as proof points to actually get that money to commit or qualify for the funds if you talk about a national insurance scheme or things like that. Work back from that and basically then provide those proof points, and before that you will need some TA or making sure that the approach in the second phase is the correct one. So those are my thoughts for now, Joanne. Thank you.